When we talk about health, we often gravitate toward the big dramatic moments. The heart attack, the stroke, the diagnosis. But what if I told you that one of the most powerful indicators of your future health isn't loud or dramatic at all? It's silent, it's subtle, and it shows up in two little numbers on a screen that most people glance at, then quickly forget: your blood pressure. Those numbers are not just medical data. They're not background noise in your annual checkup. They're signals, real-time updates about what's going on deep within your arteries, your heart, your nervous system, and even your emotional life. Blood pressure is like the pulse of your internal environment, and like a well-written novel, it tells a story. The problem is, most of us were never taught how to read that story. Let's start by demystifying what those numbers mean. You've probably heard someone say, "My pressure was 130/85. But very few people stop to ask, why does that matter? The first number, the systolic pressure, measures the force your blood exerts on your artery walls when your heart is actively pumping. That's your heart at work. The second number, the diastolic pressure, measures the force when your heart is at rest between beats. That's your heart recovering, renewing. So every time you get your blood pressure taken, you're seeing the balance between exertion and recovery, tension and rest, push and release. That's more than physiology. That's a metaphor for how you live. Are you always in a state of push, always exerting, striving, moving, never resting? Is your body constantly prepared for battle, even when no battle exists? That chronic tension doesn't just live in your mind, it lives in your arteries. And blood pressure records, like a seismograph records an earthquake. Think of it this way: your blood vessels are meant to be flexible, responsive. They should expand and contract with ease, adapting to your body's needs. But when blood pressure stays elevated, it means those vessels are under constant strain. Over time, that strain leads to damage, tiny tears, inflammation, and hardening. The higher the pressure, the more wear and tear accumulates. It's a slow erosion, one that builds silently over years until one day something gives way. And here's a deeper issue, because blood pressure doesn't hurt, because it doesn't cause symptoms in its early stages. We treat it like it's not urgent. But that's the great danger. High blood pressure or hypertension is often called the silent killer for a reason. It quietly increases your risk of heart attack, strokes, kidney disease, and even dementia, all without a warning shot. It's not that the body doesn't warn us, it's that we don't know how to listen. But this isn't just a lecture about danger, it's an invitation to curiosity. Because once you understand what your numbers are saying, you can begin to respond, not with fear, but with wisdom. Blood pressure doesn't rise in a vacuum. It's a reflection of your entire way of living. What you eat, how you sleep, whether you exercise, how you respond to stress, whether you carry resentment or let things go, these all influence the pressure within your arteries, and unlike your genetics, these are things you can change. Let's go even deeper. Elevated blood pressure is in many ways a signal that your body doesn't feel safe. Think about that. Your heart and vessels are acting as if they're in a constant state of alert. From an evolutionary standpoint, that made sense. If you were being chased by a predator, your body needed to ramp up blood flow, tighten the vessels, and prepare for action. But today, the predator isn't a lion, it's your inbox, your bills, your self-criticism, your disconnection from the rhythms of nature, from your breath, from your sense of peace. That's why a blood pressure reading is never just a number. It's an indicator of alignment or misalignment between your body and your lifestyle. And I say that not to induce guilt, but to inspire action. Because when you start to approach those numbers as a conversation rather than a condemnation, you reclaim power. You begin to see them not as a threat, but as feedback, guidance, a compass pointing you toward balance. And balance is really what this is all about. Not perfection, not control, but balance. The ability to move between effort and ease, tension and release with grace. That's what a healthy cardiovascular system does. And that's what you too are capable of. When you begin to listen, really listen to what your body is telling you. So next time you see your blood pressure reading, pause, Don't look away. Don't dismiss it. Let it speak, because it is speaking. It's telling you how your heart is coping with the life you're living. And if you don't like what it says, you're not powerless. You're simply being invited to change the story. Because those numbers are more than statistics. They're reflections. And the better you understand what they're reflecting, the more clearly you'll see the path back to health. When most people glance at their blood pressure reading, they might see two numbers, say 130/85, and file it away without giving it much thought. But these numbers are not interchangeable, and they certainly don't tell the same story. In fact, understanding the difference between systolic and diastolic pressure is essential if you want to truly grasp what's happening inside your cardiovascular system. These two values represent different moments in the rhythm of life itself: contraction and release, action and rest. And just like in life, both moments matter. The systolic number, the top number, is the pressure in your arteries when your heart contracts, pushing blood out into the body. This is your heart's moment of exertion, the peak of its force. It's when your body is energized, active, and responding to the needs of your muscles, your brain, your organs. In many ways, it reflects how hard your heart is working to keep you alive. Now think about the diastolic number, the bottom one. That's the pressure in your arteries when your heart is resting between beats. This is recovery, restoration. It's your heart's brief moment of stillness when the chambers refill with blood. It's subtle, but profound. If systolic pressure is your body's way of asserting itself in the world, diastolic pressure is the art of pulling back and preparing for the next moment. And that dynamic between push and pause is at the core of both your physical and emotional life. What's fascinating is how these two pressures interact to create a picture of your overall cardiovascular function. A high systolic pressure with a normal diastolic reading may indicate stiff arteries, something we often see as people age. The blood hits resistance as it travels through vessels that have lost some of their elasticity. On the other hand, if both numbers are elevated, it suggests a more systemic problem, something deeper in the way your body handles stress, inflammation, or fluid balance. And here's where things get especially interesting. Most people think that the systolic number is the one to worry about. It's certainly important, but more and more research is showing us that the diastolic pressure, especially in younger people, can be a critical predictor of long-term heart disease. If your heart can't rest effectively, it never truly recovers. It's like an engine that's always running hot, never cooling down. That slow, relentless pressure takes a toll. There's also a psychological dimension to this. Think about your own life. How often do you give yourself permission to pause, to truly rest, not just physically, but emotionally, spiritually? We live in a culture that rewards constant motion. We celebrate hustle. But the heart doesn't thrive on hustle alone. It thrives on rhythm. And if there's no downbeat, no recovery, something eventually breaks down. So when your diastolic number begins to creep up, it may be your body's way of telling you that your rhythm is off. It's easy to forget that the heart is not just a pump. It's a responsive, intelligent organ. It listens to signals from the nervous system, the endocrine system, the immune system. It adjusts to how you think, how you move, how you eat, how you breathe. Systolic and diastolic pressures aren't static. They rise and fall in response to the story you're living. And when those numbers become unbalanced, it's not just a medical issue. It's a life issue. For example, someone who is constantly in a state of fight or flight, rushing from one task to another, driven by anxiety or pressure, may see a rise in systolic pressure. That's the heart responding to urgency. But if there's no real rest, no deep sleep, no moments of parasympathetic calm, the diastolic pressure may begin to rise as well. That means your heart is working even when it shouldn't be, even when it needs to heal. So how do we respond to this knowledge? First, by shifting how we view those two numbers. They aren't just points on a chart. They're moments in time. They're reflections of how we live, how we cope, and how we recover. And second, by reclaiming the rhythms of life that support healthy pressure, movement, and stillness, work and rest, tension and release. That might look like small things, taking 5 minutes to breathe deeply before a stressful meeting, prioritizing sleep not just as a luxury but as medicine, choosing to eat in a way that supports vascular health, less sugar, more magnesium, more hydration. These are not quick fixes, they're patterns, rituals, and over time they begin to shift the pressure. So the next time you see your blood pressure reading, don't just glance at the top number. Look at both. Ask yourself what they're telling you, not just about your heart, but about your life. Are you giving yourself enough moments of contraction and expansion? Enough space to recover? Enough quiet to hear what your body needs? Because in the end, your heart is talking to you in every beat. And if you learn to listen, truly listen, you'll find that those two numbers are not just a measure of health, they're a mirror of how you live. And perhaps more importantly, how you could choose to live differently, starting now. Imagine for a moment that your arteries are like a city's highway. When traffic flows smoothly, everyone gets where they need to go. Oxygen reaches your brain, nutrients reach your muscles, and waste is carried away efficiently. But what happens when the roads start to narrow? When congestion builds up and the flow slows to a crawl, that's exactly what's happening inside your body when plaque builds up in the arteries, particularly those feeding the heart. Now, plaque isn't something that just appears out of nowhere. It's the result of years, often decades, of subtle damage, microscopic injuries to the inner lining of your blood vessels. And in trying to heal that damage, the body does what it always does. It patches the problem. It sends cholesterol, immune cells, calcium, and fibrous tissue to the scene. The irony is the body's trying to protect you, but over time, these patches become a burden. They accumulate layer upon layer until they start to obstruct the very flow they were meant to preserve. And that's where the danger begins. As these plaques grow, they don't just narrow the arteries, they destabilize them. The surface of the plaque can rupture, exposing its contents to the bloodstream. That triggers the body's clotting response, and suddenly you have a blockage. A blood clot that can completely shut down flow to part of the heart. And when that flow is cut off, even for just a few minutes, heart muscle begins to die. That's what we call a heart attack. But let's step back and look at the psychology of this. Because the buildup of plaque doesn't just reflect a physical process, it's also a metaphor for the way we often live. We carry things for years: stress, resentment, bad habits, unprocessed trauma. And layer by layer, it adds weight. It narrows our emotional bandwidth, just like plaque narrows our vessels. We lose flexibility physically and mentally. We become reactive instead of resilient. And when the right trigger hits, a confrontation, a crisis, an insult, we rupture, we explode, we shut down. The parallels are powerful. And there's another layer to this. Most people assume that cholesterol is the villain here, that high LDL is what causes plaque to form. But the real story is more nuanced. Inflammation is often the instigator. It's not just how much cholesterol you have, it's what kind of environment it enters. If your blood vessels are inflamed because of poor diet, lack of sleep, chronic stress, or toxic relationships, then cholesterol becomes more likely to oxidize and lodge in the vessel walls. It's not just about the numbers, it's about the terrain. That's why so many people with normal cholesterol still suffer heart attacks. And it's also why lifestyle changes can be so powerful. You're not just managing a number, you're changing the internal environment of your body. You're making it less likely that plaque will form, and even more importantly, less likely that existing plaque will rupture. Now, here's something most people don't realize. Plaque doesn't need to completely block an artery to cause a heart attack. In fact, many heart attacks occur in arteries that were only partially narrowed. It's the sudden rupture and clot that causes the crisis. That's why people who feel fine, who have no symptoms, can still be walking around with serious underlying risk. You don't have to feel pain to be in danger. You just have to ignore the signals. But we can listen, we can make choices today, not tomorrow, that shift the trajectory. We can eat in a way that reduces inflammation, more greens, more omega-3s, fewer processed foods. We can move our bodies because movement enhances circulation and supports vascular flexibility. We can sleep, we can manage stress, we can have deeper conversations, build meaningful connections. All of these are acts of self-care that reach far deeper than cosmetics or surface fixes. They strike at the very root of how plaque forms. This isn't just biology, it's biography. Your arteries tell the story of your life, and you have the power to change the ending. That's the real message here. The formation of plaque is not inevitable. It's a slow, reversible process if we are willing to live differently, not just eat differently, but breathe differently, think differently, love differently. So I want to leave you with this thought. Every moment of choice is an opportunity to clear the path, physically and emotionally, to open up the flow of life again. Don't wait for the rupture. Act before the silence of symptoms becomes the scream of crisis. Because the greatest power we have is the power to change. And the greatest gift we can give our hearts is the space to do what they were designed to do. Flow freely, beat strongly, and carry us into the life we're meant to live. Now let's turn to the symptoms. The body's early warning signs when a heart attack is unfolding. This is one of the most misunderstood and dangerously overlooked areas of cardiac health. People imagine a heart attack will always come with the dramatic, crushing chest pain, like something out of a movie. But the truth is, it's often subtler than that. And understanding these nuances, really being able to interpret what your body is telling you, can be the difference between life and death. Let's start with the classic symptom, chest discomfort. But even here, language matters. It's not always pain in the traditional sense. It may feel like pressure, like someone is sitting on your chest. It could be tightness, squeezing, fullness, or even an odd sensation you can't quite put your finger on. And here's where people get it wrong. They wait for pain. But pain is not the only signal. In fact, it's often not the most dominant one. What matters is change. Any new or unusual sensation in the chest that doesn't go away with rest deserves attention, especially if it lasts more than a few minutes or keeps coming and going. Then there are the so-called atypical symptoms. These are especially common in women, older adults, and people with diabetes. You might feel short of breath for no clear reason. Maybe you're walking up the same stairs you've climbed for years, but suddenly they leave you winded. Maybe you break out in a cold sweat, feel lightheaded, or experience nausea. Some people describe a sense of impending doom, a deep instinctive sense that something is wrong. And the science backs this up. These are not overreactions. These are physiological responses to the heart struggling for oxygen. Sometimes the discomfort doesn't even center in the chest at all. It may radiate to the arms, especially the left, but also to the back, neck, jaw, or stomach. It can mimic indigestion or feel like a pulled muscle. This is where things get dangerous because the mind often rationalizes what it doesn't want to face. You tell yourself, it's just heartburn, or I must have slept funny. We downplay, we delay, and those minutes matter. This psychological layer is crucial. We live in a culture that often praises stoicism, especially in men. Push through it, don't be dramatic. But stoicism in the face of a heart attack is not bravery, it's denial, and it's lethal. The body whispers before it screams. When it comes to heart health, listening to those whispers is a form of wisdom. Now consider the way this ties into our philosophy of health. We tend to view the body as a machine, fixable only when it breaks. But the body is not just mechanical. It's intelligent, it's communicative. Symptoms aren't failures, they're signals. They're the language of the body trying to get our attention. And our job, our responsibility, is to become fluent in that language. That takes presence. It takes a relationship with our bodies that many of us have neglected. When we treat health as an inconvenience, when we ignore the subtle cues, we teach ourselves not to listen. But when we tune in, when we honor what we feel, even when it's ambiguous, we create space for early action. And in cardiology, early action saves muscle, saves function, and saves lives. Let me tell you something that may surprise you. About half of all people who suffer heart attacks had warning symptoms in the days or weeks leading up to the event. These are called prodromal symptoms, things like fatigue, sleep disturbances, a vague sense of anxiety, or intermittent chest sensations. These are the body knocking on the door, but too often, no one answers. Or we answer with excuses. We're tired because we're busy. We're anxious because the world is stressful. We don't feel well, but we'll deal with it tomorrow. The truth is, we don't have to live in fear. We just have to live with awareness. A heart attack doesn't come out of nowhere. It's the result of a trajectory, and that trajectory often leaves clues. Learning to recognize those clues, physically, emotionally, intuitively, is an act of self-respect. It's a declaration that our life matters, that we're paying attention, that we choose to stay. So here's what I want you to carry with you. If something feels off, investigate. If you sense a change, pause and listen. If your body is sending signals, honor them. It is far better to overreact and be safe than to dismiss and suffer. Don't let pride, fear, or denial silence the wisdom of your body. You only get one heart. And in many ways, you only get one chance to catch a silent warning before it becomes an irreversible event. Let that truth sink in. Let it inspire you, not to live in fear, but to live with reverence for the signals you're given. Because in the end, your ability to act when the body speaks may be the greatest expression of love you ever show yourself. Let's talk now about the most critical window during a heart attack, the moment when blood flow is cut off and the heart muscle begins to die. This isn't an abstract medical concept. It's a living reality that unfolds in real time. And understanding what happens at this stage gives us a profound insight into both the fragility and the resilience of the human body. When the coronary artery becomes blocked, typically by a clot that forms on top of a ruptured plaque, the oxygen supply to a portion of the heart muscle is immediately interrupted. Within seconds, that area of the heart begins to panic. Cells scream out chemically, signaling distress. They need oxygen, they need nutrients, and they're not getting them. Without intervention, they begin to die. But this process isn't instantaneous. That's the piece we often overlook. There's a window, a sacred window, during which damage can be limited, reversed even if we act quickly. It's usually about 90 minutes from the onset of full blockage to when permanent damage becomes severe and widespread. That's why cardiologists use the phrase, time is muscle. Every minute counts. Every delay shrinks your odds of a full recovery. That means recognizing symptoms, calling for help, and getting to a hospital isn't just good advice, it's a life-saving protocol. Now, during this emergency phase, the heart is in survival mode. The cells deprived of oxygen switch to anaerobic metabolism, a much less efficient way of generating energy. It's like trying to power a city with flashlights. Unsustainable and damaging. And as a byproduct, lactic acid builds up. The heart muscle becomes acidic, inflamed, and unstable. Electrical signals go haywire. That's why many people experience arrhythmias or abnormal heart rhythms during a heart attack. In severe cases, the heart can actually stop beating altogether. This is cardiac arrest. Not the same as a heart attack, but a potential result of one. And here's where modern medicine has come so far. We now have clot-busting drugs, emergency angioplasty, and stenting procedures that can restore blood flow if administered quickly enough. But the key is that we only get the benefit if we arrive at the hospital in time. That means minutes, not hours. And yet too many people wait. They try to sleep it off. They convince themselves it's just anxiety or indigestion. And during that time, the muscle continues to die. This is not just a biological process. It's a deeply human one, because while the heart is dying, it is also fighting. That's one of the most astonishing truths about the heart. It doesn't give up easily. Even with partial blood flow, it reroutes, recruits collateral circulation, adapts in real time. It's a reminder of our inherent drive to survive, to heal, to persist. The body wants to live, it wants to restore balance, but it can't do it alone. When you understand this, something shifts. A heart attack stops being just a statistic or a distant fear. It becomes a story of the body calling out, the brain choosing to listen, and the person choosing to act. And that choice to act is not just physical, it's emotional, it's philosophical. Because acting means interrupting denial. It means choosing discomfort over danger. It means honoring the truth of your body over the illusions of your mind. And there's a lesson in that for all of us. So much of health, especially emergency health, depends on preparation, awareness, and presence. If we wait until the crisis is unbearable, we've already lost precious ground. But if we remain attuned, if we cultivate a mindset of responsiveness instead of reactivity, we protect the heart, literally and symbolically. You see, the heart doesn't just beat to keep us alive. It reflects how we live, how we respond to pain, how we face our fears, how we prioritize ourselves when it counts the most. So when that heart is under siege, when the clock starts ticking and the cells start suffocating, we are invited into a moment of absolute clarity. Will we listen? Will we trust the signals? Will we act in time? And not just for ourselves, but for those who love us, who depend on us, who would give anything for just one more healthy year, one more holiday, one more embrace. This is not just a medical moment, it's a moral one. The human heart, in those fragile moments of a heart attack, is teaching us something profound. Life is urgent, but it's also precious. And we are more in control than we think if we choose to act before it's too late. So I leave you with this. When your heart speaks, even in a whisper, listen as though your life depends on it, because it does. Let's take a moment to talk about what happens after the heart attack, the recovery, the rebuilding, the redefining. Because for many people, that's when the real journey begins. You've survived, you've been through the crisis, you've faced the fear, the pain, maybe even that brush with mortality. Now comes the part no one prepares you for, how to live afterward. What most people don't realize is that a heart attack isn't just an event, it's a message. It's a moment when your body raises its hand and says, something isn't working. Something has to change. And whether we choose to ignore that message or honor it makes all the difference in the world. Physiologically, your heart has suffered trauma. Depending on how quickly treatment was administered, you may have areas of the heart muscle that are damaged, even permanently scarred. That scar tissue doesn't beat like normal muscle. It doesn't contract. It doesn't contribute to the power of your heartbeat. In essence, your heart becomes a little less efficient. But here's the incredible part. It can adapt. The rest of the heart can become stronger. It can remodel, repair, rewire, but only if you help it. This phase is where rehabilitation matters. And I don't just mean going to a few doctor appointments or taking the right pills, although yes, medications are important. I'm talking about the deeper work, the psychological shift, the mindset, the commitment to not just avoiding another heart attack, but creating a life that actually supports your heart emotionally and physically. See, the heart is not just a pump, it's a sensor. It responds to stress, to fear, to loneliness, to joy, to purpose. After a heart attack, your emotional landscape becomes just as important as your medical chart. Studies have shown time and time again that individuals with a sense of meaning, with strong social support, with routines grounded in mindfulness and self-care, they are the ones who recover faster, who regain strength, who live longer and better. Now let's be honest, that shift can feel overwhelming. You're told to change how you eat, how you move, how you think. You might feel fragile, unsure of your body, afraid of exerting yourself. That's normal. But remember this, healing is not about going back to who you were. It's about becoming someone new, someone who is informed, empowered, and awake to the value of life. That means starting where you are, small steps. One walk around the block, one mindful meal, one deep breath when you're tempted to react with anger or stress, one genuine conversation with a loved one about what really matters. That is how you rebuild a heart, not just with stents and surgery, but with intention. And part of that healing also involves forgiveness. Forgiving your body for failing you, forgiving yourself for what you didn't know or do. That emotional tension, that guilt or shame, it weighs more on the heart than cholesterol ever could. You can't build a strong foundation on blame. You have to lay down trust. Trust in your body's capacity to recover. Trust in your own ability to make new choices. Trust in the possibility of change. One of the most beautiful truths I've witnessed in patients is that a heart attack, while devastating, often becomes a portal, a gateway into a new chapter. People who were once checked out of their lives suddenly start living with focus. They pay attention, they simplify, they reconnect, they become fiercely protective of their time and energy. And in that process, they often end up healthier, happier, and more fulfilled than they were before the heart attack. So don't let fear define your recovery. Let it sharpen your awareness. Let it drive your transformation. Let it teach you to love your body, not as a machine to be fixed, but as a partner in your life's mission. Because here's the truth. Healing the heart is not just about mending tissue. It's about reawakening the mind. It's about aligning your lifestyle with your values. It's about choosing every day to act in a way that honors your second chance. And it is a second chance. Not everyone gets one. Not everyone walks away, but you did. That heartbeat you feel now, that's your opportunity. It's not just keeping you alive, it's reminding you to live. So take the lesson your heart tried to give you. Don't waste it, don't numb it, don't file it away under the past. Carry it forward. Let it guide you. Let it shape you into someone wiser, calmer, more present. And most importantly, don't just survive, grow. Because a heart that's been broken open is not weaker, it's wiser. And a life lived with that kind of awareness, that's not just recovery, that's rebirth.